I used to have some pretty negative views on the safe use sites that you see in states like New York and California, on where people can come and use substances in a safe environment. I think I had the stereotypical not informed view on this, right? Like, oh, you're just encouraging them to do drugs. This is where people just hang out and do fentanyl, things like that. And that being a problematic view aside, I found that people who don't like the idea of these sites tend to like the idea of what it's for in terms of using less resources for a hospital system. So I want to give you two different patient scenarios, right? Like, one is I'm a person and I use IV drugs, and then someone calls an ambulance for me because I'm nodded off and I'm not responding, right? You have at least two medics and an ambulance that goes to an ER that is triaged by a nurse or a doctor that has some level of provider, an NP, a PA, and or an attending. Sometimes there's residents. If it's an academic setting, there could be a couple residents and a med student and an intern who's rotating from podiatry in the ER, right? You have all of that attention from all those professionals, and then they get an IV and a monitor, and they need to metabolize whatever substance they used. If they're agitated because it's an agitating experience to be thwarted from your home or the street or things like that, and to be in an unfamiliar environment, right? So let's say it takes 2 to 12 hours to come down from that high or whatever it is, and now you're sober again, and then the provider needs to come back and reassess you, and sometimes there's a social worker there who gives you resources that you may or may not use. Easily 20 people are involved in this encounter, right? And there's a dollar amount based off that visit and the people involved. Or, in a safe use site, you can go to a place that has some medical professional, maybe social work as well. You can test substances for fentanyl, for xylazine, or tranq, right? You can be given clean needles or supplies. You can lower your risk of transmittable infections. Studies are starting to show that it can decrease the risk of missing a vein, which can lead to infections, can lead to necrosis and limb loss, which also have prolonged hospital stays associated with it. People are given extra supplies so they can do things safely, whether they're in that facility or outside. If people want information on getting started on methadone or buprenorphine, they can have those things. And it's unfortunate, that so much of this conversation is not treating people like people, is treating people like numbers and dollar values. But in people that are so diametrically opposed to the idea of safe use sites, that's a way of thinking that has gotten through to them, at least in my opinion.